Now look at another face issue, and this is what is known as the asymmetry of the lower jaw. So what is asymmetry of the lower jaw, and what could be the things that could possibly cause an asymmetry of the lower jaw? So symmetry is basically something that is equal, both left and right is equal. And once you say asymmetry, that means what? Both right and left are not equal. So you could also see this. Your chin could be deviated to the left or to the right, or one side is smaller than the other one. So asymmetry of the lower jaw just refers to a condition where one side of the mandible is different in size. It could be shape, it could be position. Okay, so what we have is this. Causes. It could be developmental issues like unequal growth of the mandible during childhood or adolescence, and also congenital issues like hemifacial, microsomia. Could also be trauma or injuries to the jaw that didn't heal well. Then pathological conditions like benign or malignant tumors affecting bone growth. And also we have the temporomandibular joint disorders. There's sometimes functional factors like you just like chewing your food on one side, just on one side. So over time, your jaw deviates to that side. Law of disuse and use. They will have muscle imbalance. They will have dental or orthodontic issues like malocclusion or tooth loss. So this usually leads to uneven forces on the jaw. So clinical features is you can clearly see that the person's face is not balanced. So one side is actually longer or shorter or shifted. They also have misaligned bite. If you try to bite something, it's not adequate. Also, you have difficulties chewing or speaking. You have pain in your temporomandibular joint, Then also psychological impacts, like you don't like the way your face looks, So diagnosis is just clinical examination. We are trying to examine the patient and look at what range the issue is there. Then you can image using CT scans, X-rays, MRIs for the temporomandibular joint evaluation and also dental evaluation. So management is, if the case is mild, you can just observe, but if the case is moderate, they can actually do all those corrections, trying to tell the person how to, handle their mouth. The severe cases is when they now do all those surgeries, orthodontic surgeries, temporomandibular joint surgeries, and they can also rehabilitate the person.